All right. So first is, how did you find out about the office?
I found out about the office because I was doing research online correlated to hypothyroid.
Mm-hmm.
And I came across Dr. Farley. I saw some of his videos, and I liked the research-based approach that he takes.
Okay. And did you visit any doctors before coming to Dr. Farley?
Yes.
Yes.
Many.
Many?
Yeah, many.
All right. Did you try any drugs for the conditions?
Yes. I'm on, for the hypothyroid, I take medication for that.
Okay. Still taking it?
Still taking it.
Okay. And how long did it take to start seeing results from the care Dr. Farley gave to you?
I started right away. I could see within a few weeks that I was feeling much better. As far as some of I had a lot of dizziness, a lot of fogginess, brain fog, that type of thing that I wasn't used to. So that cleared up pretty quickly.
Okay.
So I started seeing results within the first few weeks.
First few weeks, like
yeah.
2 to 4 weeks, you said?
2 to 4 weeks, yeah.
Okay.
Still getting better.
Right. And did that affect you taking medications or anything? Did that change with the care?
No, not just yet. I'm hoping to, cut the dosage in half.
Okay.
Hopefully.
And how's your outlook on your health now as it is, and how you expect it to be in the future?
Right. Well, I always worked hard on my health, but for some reason, there were a lot of roadblocks. So the hypothyroid, because it's such a broad, sweeping problem, the other issues that I was having, like chronic soreness, that type of a thing, even though I was on the medication, even though I was trying different dietary things, it didn't seem to take away all of the symptoms that I was having. So it wasn't until I came to Dr. Farley that I really had a good understanding of what was going on.
And how to fix it and how to take care of it.
Yeah, how to fix it. A lot of it was, even though I was doing a lot of things the right way, or what Dr. Farley said, that I was sniffing around in the right spots.
Right.
But I wasn't able to take that. I'm not a professional, so I couldn't take that to the next level. And the food, which I was aware of, and I thought that I was doing a really good job with the food. I was eating gluten-free, I didn't eat sugar, but I was still having inflammation, and I was still having, so it wasn't until the expanded blood panels and an understanding from Dr. Farley to understand that the food, which food is medicine, I get that, but I wasn't exactly sure what I was allergic to. And so there was a tremendous difference before and after when I cut out the foods that I wasn't supposed to be eating, dairy, wheat.
After seeing the whole expanded panel with tells you what you have antibodies against, all that stuff.
Exactly.
Yeah.
So the information is a bit overwhelming.
But it's
so
all
it's
useful.
Good. It's all useful, and obviously you have Dr. Farley to break it all down for you, because it can be really overwhelming getting all of that information. And being a person who does a lot of research myself, it was very overwhelming. But good information and broken down so that you can understand it. So, at first I was like, I'm watching all these videos. It's a lot of information kind of coming at you, but you need to understand it to be able to understand the why, so that you continue to be motivated to continue to stop eating things that you shouldn't, right? And it's not like chocolate and candy. It's just, even vegetables that you could be allergic to. So, how would anyone know what their body is reacting to without having the knowledge?
Blood work.
Right.
And have any of the conditions you mentioned improved since you've been here?
Yeah, all of my conditions have improved. Some of them more than others, but I'm continuing, because it's been 6 weeks, 6 to 8 weeks at this point. So I'm still continuing. I had a lot of chronic soreness for years. So that, I think, is going to take a little bit of time.
Okay.
So.
And then how's that improved your everyday life, just those improvements?
Energy has increased. I work quite a bit. I work a lot of hours. I do research, but I didn't have the energy that I had before, so that's improved quite a bit. So I can work more. I have a lot less of the symptoms, like the dizziness and the other chronic pain that I was having. So that's improved quite a bit. So it's made my quality of life much better. So I'm hoping that it'll improve 100%. So I'm getting there. But again, it takes work.
Yeah, it's a process.
There's no magic wand.
Yeah.
Although the first few weeks, that did feel like a magic wand of sorts, because it's nice to get to the root of why you're not feeling well.
Exactly. All right. And how likely would you be to recommend the office to someone that was suffering from any condition that they're looking for help for?
Yeah, I mean, I would recommend it to anyone who could withstand the process, right? I mean, not everybody is cut out to continue to do the work, and I get that, but obviously, if you're not feeling well, most people would do anything to feel better. So I certainly do feel better, and I would recommend it to anyone who's been to multiple doctors. I mean, I've been diagnosed with fibromyalgia, which I never believed that I had it, you know, the chronic soreness and that kind of stuff. I've done MRIs, I've been to endocrinologists for the thyroid. Nothing really seemed to help, and it has been years. So this is the first time that I feel relief with the symptoms. I mean, it's all symptoms that I could probably have continued to live with, but they were getting worse.
Right.
As the years went on. So I'm glad that by making the dietary changes and doing the work that I'm doing here in Dr. Farley's, I'm feeling much better, and I'm hoping to improve quite a bit, and hopefully long-term and forever, and so that the symptoms don't come back.
Right. That's the ultimate goal.
Yeah, of course.
All right.
Right?
Yep, exactly. All right. Thank you.